Michael Dumont Nidijnikaj, Wabeshishe Nindodem, Shawnaga Nindunjiba, Kumaskuyam Squamish Tsleil-Waututh Ninda. My name is Michael Dumont. I am Anishinaabe Martin Clan. I'm a member of the Shawnaga First Nation, and I am very honored to live here on the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. I am a family doctor and the medical director here at Luma Medical Center. I've been here for the past 5 years. I came into this work as originally an Indigenous student at UBC, Faculty of Medicine there. And I did some of my training at the University of Calgary, my residency training, and worked for a couple of years at the Siksika Nation right after I graduated, and learned a lot of really good things about how to do family medicine in a good way there. Learned a lot of lessons from some of my mentor physicians as well as the elders in the community there. But something was really missing as far as how we were providing healthcare in that space. And the piece that really felt like it was missing for me was the traditional medicine and honoring our traditional ways in a healthcare space. Very serendipitously, I stumbled upon actually an FNHA posting for this new health center that the Luma Native Housing Society was in the early processes of planning. And I jumped on a plane, this is back in January in 2016, on a really cold, rainy Saturday, and had a meeting with the leadership at Luma Native Housing. And I think it took about 10 minutes. I immediately, resonated with what the Housing Society leadership felt was needed in terms of healthcare here, working with urban Indigenous peoples, and really feeling that there was a missing gap in terms of safe places to access primary care for families, for Indigenous families living in the city. And when you're talking about primary care, the relationship is the intervention in terms of what you're trying to do for your patients a lot of the time. For people that are recovering from trauma or have had experiences of racism or discrimination in the healthcare system, being a safe person to go to and actually creating an environment where somebody can feel a sense of trust coming in with any sort of healthcare concern, any health complaint, and not fearing judgment or retribution or ill treatment. That makes a huge difference. So many of our family members, Indigenous people in this country, fear going to see the doctor, fear going to the hospital, fear going to the emergency room because of the way they're going to be treated. But you walk into the space normally, and there's kids running around, you hear drumming in the back, there's people singing. It's just this beautiful, chaotic space, but it's a space of healing. There is calmness and stillness in it as well, and it's just an environment where I think most of us feel comfortable. And if you're an Indigenous person walking in, you feel it in the walls. This space is okay, this is a space for me.
I'm Ali Tanje Nikudankokoi Dijnakas Mahingadodem. I'm Wandering Cloud Woman of the Wolf Clan. I've been here for about 4 years now. And without Luma, I wouldn't be sober. Yeah, this place has been amazing. I said more than once I should actually be paying these people rent. Because I come in and everybody's, hey, how you doing, And I go into a walk-in clinic, take a number, sit down, I'm not into that kind of thing. I'm too friendly. I think it's because it's built on a First Nations model. It's not a bunch of white people running around telling us how to do our ceremonies. It's us doing our thing. That I think that's a big part of why it's a success.
Amishkait, which means good day in my language, the Lilwat Nation. In Squatch Islam, my ancestral name is Seslam. I come from Lilwat country. 100 miles northeast of those beautiful mountains is a place called Lilwat, not Mount Currie. We claimed all the names, the traditional names of our territory. Names of the mountains, the rivers, the lakes. All the old landmarks were renamed by our people. And I was hired to come and work here to take over from an elder who used to be, or still is, my AA sponsor. I was sober 45 years, one day at a time, just for today. I tried to retire back in 2016, but they threw a fishing line out and they reeled me in. They said, no, you're not going to retire. We need you to come back to work. So once again, I started work with the Luma Medical Center back in 2016. And this very room that we're in right now was the center of all the work, of all the beautiful things that were going to come to be. And as you can see, it's based on the concept of the longhouse with the cedar. And but it's meant to incorporate all the teachings from all over Turtle Island, with First Nations people, with the Métis, with the Dene, with all the beautiful people right across Canada. And I was basically hired to work as an elder in residence. And I looked at that position and I said to myself, this is a culmination of all the work I've done in the 45 years of my sobriety. I helped to introduce traditional Indian medicine to the prison system back in 1984. And what that did, it opened the door for the urban Aboriginal population to take a look at how can our culture, our way of life, be incorporated into doing the healing and the recovery that our people needed to get involved in since the mid-80s. And I have to say that I'm a traditionalist at heart. I will work with the doctors and the nurses, but I will break down the barriers in terms of their teachings, their understanding. So today, in all the work that we do in the healthcare system, the education system, the social services system, all the businesses and all the corporations, they come to us. That's for the truth. They come to us in terms of how things are supposed to be done. And I say to the doctors and the nurses that there are things that are clinical. So we can live with that, but know this and understand this, that we are traditional people. We will go back to the age-old ways our people did things in the past and base it on the four seasons. Base it on the sacred powers, the sacred elements of the fire, of the earth, of the water, of the air. That is who we are. When they reach, the doctors and the nurses reach the kind of like the end of the line with the patients that come here, and they're kind of like lost, and kind of like giving up, they send them in to us, and we say to them, there's always hope. There's always hope. And so we ask you to come in. We will brush you off, we will smudge you with that batter, we will take you to the sweat lodge, we will take you to the cold water, we will bring you the medicine that you're going to need for your healing and for your recovery. Half the battle in anybody's healing isn't what you believe. I learned that from my grandmother when I went up to visit her in my early days of sobriety. She looked into my eyes and she said to me, "I'm the Toktakwinekun grandson, it is good that you believe." At that moment, my fist went up into the air and I said, "Yeah, Grandma, we're going to fight back. We are the truth. Nobody could ever take that away from us." So, in these past 5 years, I watched changes take place in this very room. I watched changes take place in terms of the growth of the clinic, in terms of the people who are hired to come and work here. And the only thing we put out to them is have an open mind, be honest, and be willing. Be willing to do something that's different. That's not based on clinical medicine. It's based on our traditional beliefs. My great-great-grandmother Mahiox, when she died, she was 123 years old. She said, "This is the way that our ancestors taught us how to live. These are the sacred laws and principles by which we live, and we will do what we can to hold each other up and to help each other."